Good day to you, Sister Komoso, and to the listeners of Radio Veritas. I am Melese Shula, the Director for African Stakeholder Engagement at the International Association of Catholic Mental Health Ministers, and I am based in Johannesburg. My role is to promote and oversee the development of the Catholic Mental Health Ministry across the African region. This ministry is very close to my heart, as I have witnessed firsthand the positive impact it has had on the lives of many individuals since we began implementing it in our country here in 2022. I am pleased to share with the listeners of Radio Veritas how the development of the Catholic Mental Health Ministry is unfolding here on our soil and beyond.
So, Dr. Melese, thank you so much again for joining us. Can you share on the development of the Catholic Mental Health Ministry, which is unfolding in South Africa and beyond?
The development of the Catholic Mental Health Ministry is steadily growing across South Africa and several other African countries. Since its introduction in 2022, South Africa has been increasing support from bishops, clergy, and lay leaders. I must say that some of our bishops have shown great pastoral sensitivity by endorsing and guiding this essential ministry. In various dioceses, such as Klerksdorp, Bethlehem, Archdiocese of Johannesburg, Rustenburg, Aliwal Diocese, and Witbank, priests are integrating mental health awareness into pastoral care and homilies. Lay Catholics, many with backgrounds in psychology, counseling, and healthcare, are also stepping forward to serve. Workshops, awareness campaigns, prayer groups have been launched in many of these parishes and diocesan centers. When we go outside South Africa, in Nigeria, the ministry is gaining momentum through the commitment of dedicated lay people, Catholic mental health professionals, and clergy who recognize the urgency of the mental health crisis. Kenya also has made significant strides with diocesan team, for example, in Nairobi, already formed, and preparing for training in ministry implementation that is to be held sometimes in September this year. In Uganda, nearly all of the 27 Catholic dioceses have embraced the ministry as an integral part of their pastoral activities. In Ethiopia, the Catholic Eparchy of Adigrat has launched the ministry following initial training we conducted last year with diocesan priests. In Botswana, particularly in the Diocese of Gaborone, there are encouraging signs as lay leaders initiate community-based support models. Of course, I was in Gaborone also, the 3rd of May, where I had a workshop with a group of pastoral agents, and then our Archbishop, His Grace Archbishop Frank was also present. And in Eswatini, partnerships between the church and mental health professionals are also being actively explored. And across these countries, I would say the ministry is rooted in compassion, healing, and the recognition of every person's dignity. The commitment of church leadership is transforming this vision into a movement of hope and restoration. And I am truly witnessing a spirit-led response to one of the most urgent human needs of our time.
What is the starting point when planning to implement the ministry? I think most of the people are asking themselves, okay, if we invite Dr. Melese to a parish or to a diocese, how do we go about it? So what is the starting point when implementing?
When planning to implement the Catholic Mental Health Ministry, the starting point is always prayerful discernment and pastoral readiness, rooted in the guidance and endorsement of church leadership. Since this is purely a pastoral ministry, the support and blessing of the local bishop and parish priests is absolutely essential before moving forward with any implementation. To assist in launching this ministry, the website of the International Association of Catholic Mental Health Ministers offers a wealth of valuable resources that parishes and dioceses can use free of charge. These include implementation guidelines, introductory videos, testimonies, and experiences from international Catholic communities who have already begun the journey. So these materials provide both inspiration and practical steps for starting the ministry at the local level. In addition to these resources, I'm also available to offer guidance and support and workshops, whether through Zoom, Microsoft Teams, or other virtual platforms. I'm happy to work with any Catholic parish or diocese interested in establishing this ministry. I'm committed to assisting whenever and wherever I can to help this ministry of healing, hope, and compassion.
Well, thank you. Thank you very much for that, Dr. Melese. Now, when it comes to the core activities, what are the core activities of the ministry, especially within the Catholic communities?
Yeah, it's good to know what the core activities of the Catholic mental health ministry are. The core activities of the Catholic mental health ministry focus on integrating mental health support within the church's pastoral mission. These activities are rooted in compassion, accompaniment, and the dignity of every person. Some of the what you call the components, or the key components, I would say, of these activities could be: one, education and awareness. That would be hosting workshops, talks, and seminars in parishes and dioceses, educating clergy, lay ministers, and parishioners on mental health issues and the church's compassionate response, distributing also materials to reduce stigma around mental illness, providing safe, welcoming spaces for individuals living with mental health challenges, offering prayer groups, spiritual direction, and peer-led support gatherings, integrating mental health intention into liturgies, for example, masses and intercessory prayers during the celebration of the Eucharist, and training lay ministers and volunteers in active listening, pastoral presence, and mental health first aid, and offering, for example, one-on-one pastoral accompaniment, that would be non-clinical, supportive presence, and refer individuals to mental health professionals when needed. And the other aspect, for example, collaboration and referral, building that relationship with Catholic and non-Catholic mental health professionals, creating referral networks for those who may need clinical care, and collaborating with diocesan offices, for example, Family Life Desk, youth ministry, for integrated support. And also support for families and caregivers, facilitating support groups for families and caregivers of people with mental illness, providing support, spiritual support, resources, encouragement, and sense of community, and encouraging full participation of individuals with mental illness in the life of the church, because in most cases, people with some sort of mental health challenges prefer to just simply to isolate themselves from the church activities, even being members of some sodality or groups. In this case, then advocating for accessibility and understanding within parish ministries. Perhaps for me, the last point, the last but not the least, promoting the dignity of every person, especially those affected by mental health conditions, and challenging that misconceptions and cultural stigma around mental illness are somehow the core activities of the Catholic mental health ministry.
Oh, that is interesting. I think, like Dr. Jennifer had said, that there's so many activities that that the ministry has, and hearing about the spiritual support groups. I think that is very important, especially in our Catholic context, because it allows people to be themselves in a space that they're familiar with, which is something that is amazing. And thanks again for that, Dr. Melese. Now, finally, before I let you go, could you share any experiences from your recent visit to the Diocese of Gaborone for the training?
Yes, thank you. Perhaps the advice to the Catholic parishes on embracing and integrating the Catholic mental health ministry into their pastoral activities. I would say perhaps begin with prayer and discernment, seeking the guidance of the Holy Spirit as you want to embrace the Catholic mental health ministry. Obtain the endorsement and blessing of your bishop or parish priest before starting. Recognize mental health as a pastoral concern deeply rooted in the church mission of compassion. Educate your community to reduce stigma and promote understanding around mental illness. Form a small team of committed clergy and lay people to lead this initiative. Use the free resources, as I indicated earlier on, available on the website of the International Association of Catholic Mental Health Ministers to help you start and frame the implementation of the Catholic mental health ministry in your diocese and in your parishes, in your general Catholic community. Offer talks, workshops, and prayer services that include also mental health theme. Provide a safe, welcoming space for those who are struggling to be heard and supported, and train volunteers in pastoral listening and mental health awareness. Build relationships with local Catholic counselors or even with the local clinics and hospital, or mostly in psychiatric hospitals, and mental health professionals. Include prayers for mental health in masses and parish intentions. Above all, lead with love, compassion, and the desire to reflect Christ's healing presence. For me, that is what the Catholic mental health ministry is all about.
Thank you so much, Dr. Melese, for that. Thank you for sharing about your experience. And we're hoping that the ministry in the Diocese of Gaborone continues to grow and eventually it passes on to the Diocese of Francistown. Thank you so much for joining us, Dr. Melese, and for making time to share with our listeners on the ministry and how it's growing in the African region.